Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. Today we have a special topic that is comparing Ayurvedic medicine with the Western medicine. I have a special guest today, which is Dr. Shashi Rekha. She is the director of the One Day Wellness Global healthcare system with multiple branches, the one located in Florida. And Dr. Shashi Rekha, welcome to Triple N Media. We're delighted to have you. And let's talk about, what is Ayurveda and how it compares and contrasts with the Western medicine. In fact, I went to Mysore Medical College, left there in '73. I've been practicing Western medicine for 50 plus years. So let's see how Ayurvedic medicine differs or compares with the Western medicine.
Glad to be here, sir. Of course, many people these days are much interested towards Ayurveda medicine. So I would like to make people know that it is one of the most ancient science of life. So it deals with everything around life as well as help us to make the stability in health concern, both of physical health as well as mental health. So such a unique approach we do have in this life science. The way it differs from Western medicine is that the root cause of the disease is a concern in treating the disease. So we often go managing to provide food as a medicine, take some changes in the food, and do help make the recommendations according to the season, as well as conduct the detox procedures to help understand and release the cause behind the problem.
Is it more like a preventative approach to wellness versus the acute treatment like we have in this country? If somebody gets a pneumonia, we give them antibiotics, they go home, and or if they have a high blood pressure, we give them treatment for bringing the blood pressure down, but not necessarily reversing the process. How does the Ayurvedic medicine differ in this respect?
Definitely a lot of scope and concern on preventing the diseases is there. So we do see a lot of lifestyle recommendations starting from beginning of the day to timings of the food, as well as timings to attend to your natural calls, how to train your biological clock, as well as support like an individual constitution balance. So there's a lot of things one should understand, educate himself about. So as an Ayurvedic practitioner, we do spend a lot of time conveying the same to the clients. The patients do understand about the situation they are going through and become able to manage the same in relevant context. So that's why it's more towards a preventive element. And of course, to a lot of extent, acute management is also there, but for the diseases like heart ailments, obviously we reach up to the help of the emergency medicine.
Absolutely. Back in the 80s when I started cardiology, of course, most of the focus was on reducing the cholesterol, reducing the blood pressure, reducing the blood sugar. But nowadays, even the Medicare supports the preventative approaches. So would you say Ayurvedic medicine is a sort of complementary to the Western medicine, and the Western medicine is complementary to the Ayurvedic versus,
Absolutely yes, absolutely yes. And the final hope is to make the sustenance of health. Obviously, it would be much more wiser to handle the situation in acute condition with the Western medicine and take up all the relevant lifestyle recommendations to help the person do not get back into the same situation in his future life.
Well, as a cardiologist, one of the things we deal with are, of course, chronic diseases like heart disease, high blood pressure, diabetes, arthritis. What is the approach to Ayurvedic medicine in terms of dealing with these patients compared to the Western approach?
Well, of course, in heart diseases, as you started talking about, a lot of significant help for those clients to deal with their stress had to be given. So indeed it is all about recommending him some lifestyle changeovers, which may include practice of like very strict dieting, the help of good fat, bad fat to be educated about him, as well as the stress management skills, like it could be as simple as practicing meditation to yoga. So some poses definitely are more contributing towards quickly rebalancing your inner self as a grounding force of energy. So when executed on a daily basis, we can see a lot of significant change brought onto the person's blood pressure management as well as cholesterol management. So this will be a much support. And it's good at this point to mention that my thesis is on hypercholesteremia, and I saw a significant improvement, and it's been already 25 years I finished my post-graduation. Till today, as I practice in the same city, I get back my patients doing very well with the kind of diet therapy as well as these stress management skills.
As I said, the Western medicine is moving more and more towards the preventative aspect of these chronic illnesses in terms of reducing the progression of the disease and reducing the complications. So in a sense, I feel like we are trying to reach the same target, but from different perspective, and maybe complementary in terms of helping people to get their weight down, get their sugar down, and get their cholesterol levels down.
Yeah,
that's fascinating. Let's talk about with the Ayurvedic medicine. It's a lot of things to kind of circle around diet and herbal supplements and all this. Maybe you can elaborate on those compared to Western medicine, which is all pure chemicals extracted from various sources.
Well, at this point of time, I would like to mention about a very important tool in Ayurveda is using food as a medicine. Obviously, we eat food to satisfy our hunger as well as attend to our emotions many a times, but if well planned and educated, people start to notice the good and bad effect of the food into their daily routine. So, of course, as a physician, we would be required to spend some more extra time to make them understand that the food, particularly a disease like diabetes, for example, the food with a good GI index is the key for the absolute control. So if we make them understand like these are the actual benefit when you opt for these food and make them use the same on a daily basis, you achieve the target very easily. Similarly, in arthritis, inflammation is the key to be addressed. So there are many food which are like quickly bringing up the inflammation onto the system. So if we make them get aware of, like for example, there is gluten, there could be some very strong spices. People end up being craving for the taste of the spice. Eventually, back in India, we have been using spices, and we often see people end up tolerating much more than actual capacity of the gut. So that leads into repetition of the inflammation in the body. So once that has been stopped...
I made the wrong impression that spices would improve your immune system.
Absolutely yes, but many of them are acidic in nature. So if you have already inflammation in the body and you keep on using more of them, so that there's more kind of...
and fasting is a very common practice all across the globe. Even in America, people fast, and of course in Islamic countries, this is the fasting month because of Ramadan. Talk about the role of fasting in Ayurvedic medicine.
Obvious fasting since ages has been recommended to be done by everybody. And as a religious practice, since ages, it was being highly recommended so that people get trained to observe fasting, and then when there is a necessity, they are able to use it as a tool. So just an example, like in fever, for example, we observe fasting, or we are asked to observe fasting. The fasting doesn't mean absolutely don't eat anything. You can still allow some water to intake or water infused with some herbs, like for example it could be ginger or mint, to help support the digestive system to get back into normalcy. And in general, as a lifestyle recommendation for everybody, a healthy person also, we want to stick on to sunrise and sunset timings to eat the food, which is nothing but like an intermittent fasting as a regular note, so that you don't eat for that about 10-12 hours, which is a good time for the system to help manage complete digestion as well as give that rest for the digestive system to recuperate for the next day.
I see, that's fascinating. We covered a lot of topics in this introductory talk about Ayurvedic medicine versus Western medicine. Maybe in the next topic we can talk about one of the most commonly used procedures, that's the panchakarma or the detoxification. It's been a pleasure talking to you, and we'll be back in the next presentation with panchakarma.